Here, sit in. Give me
Okay,
station.
thanks.
Mary, come on back. Mary, when is your birthday?
1/1/91.
We're going to get your height and your weight first. And welcome. And you're here today for
A PAP exam.
very good. I'll tell you all about it.
Okay.
Welcome. Have a seat.
Sure.
We're going to grab your vitals. And we're going to grab your temp.
Okay.
It just goes under your tongue. Perfect. Thank you.
You're welcome.
Weight vitals. And I'm going to put them in the computer.
Okay.
I just have a few questions to ask you.
Okay.
Have you ever had a PAP before?
No.
Very good. If you had had a PAP before, we would have you sign a release for your records,
Okay.
so we wouldn't have to repeat information. So since you haven't had one, we will just won't have to have you sign a release. And I'm putting all your information in.
Okay.
So we're just going to type this all in. And your phone number is 319-656-7878?
Yep.
Very good. And any allergies?
Nope.
Current meds?
Nope.
What she's going to do, she'll come in and you'll have your designer gown.
Awesome.
This will be covering your legs.
Okay.
And this is your designer drape,
Awesome.
which I have already put buttons on this one.
Okay.
And you get a smiley face
Great.
because you're taking such good care of yourself. And it is open in the front.
Okay.
And then this just goes over your legs, and then you can just put your clothes there on the hooks.
Okay.
And Jan will also tell you all about having a PAP. There's different sizes of speculums.
Okay.
So we'll leave this one out as well. But they're just very small.
Okay.
And everybody gets their own individual one. So
All
we'll
right.
just leave this out here too. And then if you want to go ahead and get your designer gown on,
Okay.
and your designer robe, she'll be all ready for you.
Awesome.
We're glad you're here.
Thank you.
Thanks. Nice to meet you, Mary.
You too.
Hello.
Hi.
How are you today?
Pretty good.
Good. I'm Jan Whitehead. I'm a nurse practitioner.
Nice to meet you.
Yes. So, is this your first pap smear?
Yes.
Okay. So, I want to do a few things, a few questions that
Okay.
we like to ask before we get started to kind of determine your health history, sexual history, things like that.
Okay.
So, I'm going to get into the computer here.
Sure.
And this is your first pap smear.
Yep.
Okay. You have any questions or concerns?
Not really.
We can get a PAP for the first time. Basically, what we do is try to educate you the best we can on how to take care of yourself as a woman. And what we are looking for when we do a PAP smear is cervical cancer or abnormalities of the cervix. And guidelines have changed quite a bit as we've done lots and lots of these tests, and so guidelines have loosened up just a little bit because we've discovered that we don't need to do pap smears quite as often as we thought we did.
Okay.
So the first pap is usually at 21, which you're 21.
Mm-hmm.
And what we're also going to test for is for STIs. Usually once a year, the CDC, Centers for Disease Control, like to have young people of this age group test for STIs.
Okay.
Now, if you're in a committed relationship of long term, that probably isn't necessary. But if there's any random activity or chance that you might have one, then we test for that, and that can be done the same time the PAP is done.
Okay.
So let me just go through some questions. Have you ever had a blood clot before, or anybody in your family?
Nope.
Okay. Is there any diabetes or high blood pressure in your family?
Nope.
Heart problems?
Nope.
Gallbladder disease, liver disease?
Nope.
Any migraine headaches or severe headaches?
Nope.
Okay. Have you had any abdominal surgeries or any problems in that way?
Mm-mm.
Okay.
Nope.
Ever had any problems with your periods?
Nope.
Ever had an STI?
No.
Okay. Ever had oral or genital herpes?
Nope.
Okay, like cold sores basically. Any problems with your periods?
Nope.
Any problems with depression or anxiety?
Nope.
Okay. Any eating disorder problems?
Nope.
And basically these questions are just to screen you for any problems, or even it might trigger a question that you
Okay.
might have about yourself or something in your past. Never been pregnant?
Nope.
Do you feel safe with your current partner?
Yep.
Okay. When you were in high school, did you get the Gardasil immunization? That is for, we call it HPV, which is the human papilloma virus. It's a series of 3 shots. It was not mandatory.
Okay.
But do you remember getting anything like that?
I don't think so.
Okay. So, and if you have student insurance here, that is a free, it's paid for.
Okay.
You would get a series of 3 shots, like 1 month, 3 months, and 6 months, something like that. And basically that is to prevent the HPV, or it would trigger your immune system into recognizing HPV, which is the most common cause of cervical cancer.
Okay.
And then your immune system would actually take care of the virus. And that's what they found when they find abnormal pap smears, not necessarily cancers, but the immune system, the body's immune system, actually cures it itself without a lot of intervention. So, and that vaccine is basically kind of hurrying up the immune system to recognize that. Okay, so it is something that we offer here, and if you choose to get that, you can get it up to age 26.
Okay.
Okay, when was the first day of your last menstrual period?
The 21st of January.
Okay, are your periods regular?
Yep.
Any problems with heavy flow or cramping?
Nope.
Okay. And how old were you when you first started having periods?
15, I think.
How about seizure disorders? Any problems there?
Nope.
Okay, very good. So what I'm going to do is we're going to do a breast exam.
Okay.
Because basically you're going to get a good physical. I'm going to listen to your lungs, feel your thyroid gland, do a breast exam. We have these little handouts.
Okay.
That this is from the hospital, but it's really a good, these are things you can hang in your shower.
Oh, all right.
And it just tells you how to go about doing a breast exam. The breast is kind of in a triangular configuration on the chest, goes all the way, the breastbone goes way out here to the side and up here to almost the clavicle or the collarbone. And so every month after you've had your period, you just kind of go around in circles and check for lumps. Everyone has lumps. More of them are on the outside here and maybe closer to the nipple, but those are milk glands.
Okay.
And so some people have real lumpy breasts, some people don't, But the point of doing this at this age is that you get to know the lumps in your breasts.
Okay.
So that if you're 35 and you feel something that's not supposed to be there, you will know it before anybody else does. And that's the whole point in you getting to know what things feel like. Okay?
Right. Yep.
Alrighty, so let's have you go ahead and, first of all, we'll just do a quick, I'm going to listen to your lungs.
Okay.
Take some deep breaths through your mouth. Okay. And then I'm just going to listen to your heart. Okay. And then I'm just going to feel your thyroid. It's right at the base of your neck here in front. And we're feeling for enlargement. We're feeling for nodules, and that looks okay. All right, let's have you go ahead and lay back. Now I'm just going to listen to your heart. And then just your belly here. And your bowels work okay?
Mm-hmm.
Good. Try to eat healthy.
Yes.
Try to eat some vegetables once in a while.
Yeah, once in a while.
Now, we're going to do a breast exam, okay? So I'm going to go, so we're going to feel up under your arm.
Okay.
And then we're just going to go around like this on your breast. And there you go. And then up under the other arm.
Okay.
Very good. Okay, now, here's the fun part.
All right.
This is not painful.
Okay.
I know it's a little bit scary if you've not had sex or and then do you use tampons?
Yes.
Okay. So we have different sizes of these things. These are speculums, they're called. And this is the smallest one.
Okay.
And basically what we do, and this is the next size up. So they're really not very big.
Okay.
A tampon is about this size or this, they're just not too much different.
Okay.
And so basically the light is so that I can see, okay? And what I do is I will just insert this almost like a tampon into the vagina, and then I open it just a little bit, okay?
Okay.
Then I'm going to take this little spatula here, and this is going to I just put it in and I just kind of twist it around to be able to, now the cervix is actually looks a little bit like that.
Okay.
And what we do is we just go around, kind of around, I don't know if you can see very well, around like that, because there's just a hole in the center, and then the uterus is up here. But we just get the tissues, the skin around here a little bit.
Okay.
Then we take a brush,
Okay.
and we just go inside there just a teeny bit and turn it like that.
Okay.
And it gets the little cells on there. And it's these cells that are just inside the cervix that gets the cancer or the abnormalities. So that's why we use this brush.
Okay.
The wart virus, or the human papilloma virus, you can almost see it sometimes in white patches on the cervix if it's bad enough.
Okay.
And if there has to be an intervention of some, they usually just take a little biopsy. It's like, just tiny piece of skin on the outside of your body. It's just on the cervix there. Okay, so, but in order to get a good look at things, and for us to be able to do this, we put you in these stirrups here.
Okay.
So I want you to bend your knees and scoot your body.
Okay.
You just come way down. Keep coming. Okay. Then you put one heel right here and one heel right here.
Okay.
And the important thing for you to remember is to relax.
Okay.
Because when you relax the muscles, this little thing is going to slide in real easy.
Okay.
Open up, swab, we're out of there really quickly.
Okay.
And but when you clamp down, and you know what that feels like when you clamp down, then clamps down on this thing. So it just
Okay.
makes it a little more uncomfortable.
All right.
Alrighty, so I'm just gonna do that real quick. Do my little swabs. Let's do this. Do our little swabs. And then what we do is we put it inside. We just swish it around in this
Okay.
liquid. And this is the best technology out there right now to be able to see these abnormal cells.
All right.
Okay?
Mm-hmm.
And then what I'll do after that is I'm just going to feel, I'll just put my couple fingers in there.
Mhm.
I'm going to feel the uterus. I
Okay.
can feel the ovaries with like one finger over here, one finger over here is the other, left ovary, right
Mhm.
ovary. And that's just to make sure that there's no enlargement or cysts on the ovaries.
Okay.
Normally we can't feel them. But if we feel them, or if you have, when you have a period that's very painful and it hurts more on the right than the left, sometimes you have a little cyst on the ovary or something.
Okay.
Okay? And that's it. So go ahead and scooch on back. All right. And then what we do after that is we just take this and send it to the lab.
Okay.
We put the order in for pap smear, and if you had been sexually active, if you were worried about STIs, we would, they can get that information off this pap.
Okay.
So there's no extra swabs, no nothing, okay?
Okay.
And basically it takes about, we send this out to a lab, and it takes about a week to get the results back,
Okay.
and we will call you when we get the results.
Great.
Any questions?
I don't think so.
So if you want to be on birth control, we've kind of already done the screening
Okay.
for that. You should be able to do that just fine. But if you do decide to be sexually active at some point, we recommend to be on the pill or some form of birth control and to use condoms each time.
Okay.
All right,
Yeah.
very good. Okay, and then once you get the results of your pap smear back, if it's normal, we recommend you get a pap every 3 years.
Okay.
If you become sexually active, the guidelines aren't set in stone, but it's nice to just get tested once a year.
Okay.
Or if you're with the same person all the time, then it's not necessary.
Okay.
But what we're trying to do is decrease the risk of infections in the female reproductive tract so that we can limit infertility
Okay.
in the future. And then the pap smears are something you get every 3 years for a long time.
Right.
And the guidelines may change, but this is basically what you get to do for the duration of your female life, I
Okay.
think it is. So